Welcome everyone to today's webinar, Behind the Data, How Over-Reliance on Staff for Scheduling is Hurting Revenue and Retention. On behalf of Becker's Healthcare, welcome and thank you so much for joining us today. Before we begin, I'll walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Also, if you have any trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. And at this time, it's my pleasure to introduce today's wonderful presenter, Carly Falk, Head of Research at Notable. Carly studies health system operational challenges and generates thought leadership on the value of automation in healthcare. Prior to Notable, she led market insights and analytics for Philips North America and enjoyed over 23 years at the Advisory Board Company, which was acquired by Optum in 2017. At the Advisory Board, she created and led client services for Crimson, a physician-driven software used by over 200 health systems to compare clinician cost and quality performance. She also authored dozens of best practice studies on care variation reduction, clinical operations improvement, population health, and physician hospital engagement strategy. Carly, thank you so much for joining us today. I will now turn the floor over to you.
Wonderful. Thank you, Sarah. I really appreciate it. Thank you so much for that lovely introduction. And it is a pleasure to join you. I'm very excited to share our research on the state of scheduling automation, if you will, across the country for health systems in America. We are excited by this research because we think there's no more important time for automation to really come to scheduling in healthcare. The staffing shortage shows no sign of abating. We have high labor costs in the industry. We have lots of burnout. We have a growing number of turnover rates. And this is impacting not just scheduling, but frankly, all roles across the health system. And the call center is just one of those places that is suffering by virtue of it. But what's been so, I think, interesting to learn through this, and frankly, through the experience I think most of us have as patients, is that phone-based scheduling continues to remain the primary method for booking appointments in healthcare. In 2022, we actually at Notable surveyed patients to learn whether provider digital tools were meeting their needs, because we wanted to understand, could patients do online in healthcare what they do in airline and in banking and other industries? And while providers have invested in lots of tools, what we learned was that those tools that they've invested in are really falling short of what patients want. In fact, nearly 2/3 of patients reported in our survey last year that providers' digital tools did not meet their expectations. And worse, that online scheduling was actually often resulting in a phone call. So patients were sharing, in fact, that 70% of the time when they tried to book an appointment online, they were actually asked to call instead. So, just imagine if you were doing that when you went to book your ticket online with one of the major airlines. You rarely have to pick up the phone. You do it all online. And that is the same kind of experience that patients want when they now interact with their health system. And it's frankly the kind of experience that they deserve, because what I will share with you is data to show that, less and less are we really interacting over the telephone in a traditional call-based fashion, the way we used to act. So what I'd love to do is share with you the results from our survey. We've got 3 sections to the time we're going to spend today on this. We are going to start with just reviewing the research and the methodology. I'll then go through the survey results themselves, the section called The Status Quo of Scheduling is Unsustainable. And then finally, I'll give you 4 principles on that really guide what we think the future of patient scheduling should be for patients at health systems nationally. And then we'll open it up to some quick questions and answers. So why don't we jump into that first section, which is our research and methodology. Just the basics of when we did this research, where and with whom. We actually developed this research survey in partnership with Reaction Data, which is based in Utah, and conducted this over their platform across 4 weeks in April of 2023. The survey was conducted exclusively with employees in patient access in health systems. We had leaders through managers respond. When I say leaders, we had literally chiefs of ambulatory care respond. We also had people who were assistant managers for patient access at either health systems or medical groups respond. And we had a really wide diversity of healthcare organizations. We had 40% of our participants were from hospitals and health systems, some of those just single hospitals, and some of them multi-state health systems, as well as the rest being from medical groups, both multi-specialty as well as single specialty medical groups. So we feel as though the representation in this sample, while it's just 25, it is very well representative of what health systems look like across the country, and is very consistent with all the qualitative interviews that we have done across the last 2 years, as we have talked to patient access leaders across the country and built out our own automation capabilities. So why don't we jump into the results themselves? Let's just start with the first result, and I think it should be no surprise. The first insight is that scheduling in healthcare really remains a highly manual and telephone-based process. In fact, what we learned from our survey was that 64% of the respondents reported that more than 60% of their patient appointments are scheduled by telephone. Now, this is happening in a world where, hiring is difficult and turnover is high. Even entry-level positions right now are difficult to fill because, those entry-level positions, you're competing for hourly wages with retail and e-commerce, where frankly, they're paying much higher rates than healthcare are these days. And healthcare is always has tried to differentiate by providing better benefits. But frankly, retail is even stepping up and now providing much better healthcare benefits than they did in the past. So it's making hiring and retention very, very difficult for health systems, which means that for many, either their front desk or their call center is not staffed at full capacity. In fact, the vacancy rate right now for patient service representatives is, or at least was measured by the BLS, our federal commerce department entity that tracks such data and on employment. The vacancy rate was 12.9% in 2021, and we expect that it has increased dramatically across the last 2 years. The next insight that we learned is not just that we are scheduling most of our visits by phone, we are doing it, performing calls that are frankly time-consuming and notoriously inefficient. Call center staff are spending a lot of time on the telephone per call. And frankly, it's likely limiting access to patient care. Organizations are almost evenly divided on the time spent per call. 52% report that it takes more than 6 minutes. 24% though report that it takes over 8 minutes per call. And the weighted average time per call was 6.9 minutes. And it's important to understand that while the actual call, the time of the actual call is important, the call with the patient really underrepresents the complete effort that is associated with a telephone-based scheduling effort. Because for every call, there are actually 3 parts. There's preparation on the part of the scheduler, where the scheduler has to pull up the patient record, verify the scheduling requirements, and pull up the appropriate physician calendar. Then they have to actually make the call. So they have to make the call, and then the patient has to answer that call. And then, of course, once they're on that call, they go through the purpose of the call and reference the calendar, and they've scheduled a visit. That's the piece that takes almost 7 minutes. And then once that call is finished, that scheduler has to record the notes of the call, regardless if that call was answered. So even if they didn't answer, they have to record that they made the call. And then, of course, if that call is answered, they have to record in the EHR that the appointment is scheduled, and any patient requirements have to be referenced and verified. I've literally sat at the elbow of schedulers watching them do this process, and it is extremely time consuming. And I think if you look at the National Association of Healthcare Access Manager benchmarks, I think it's fair to say that these steps likely add well over 6 to 8 minutes to every outreach, which means that productivity is far less than, just that 7 minutes per call that it's taking to get the call done. And then what's important to note is that it's not just the call. If you are in a specialty practice, you likely are trying to get a call or a visit scheduled for a patient that has required a referral. 20 to 80% of visits, depending on the physician specialty, are going to require a referral. Now, first, before we even get to what people reported as to the time it takes to do a referral, let's just define what a referral process is. When a referral comes in, that person who has to process that referral has to verify the information is complete from the referring physician. They have to check if a prior authorization is required. They have to transcribe that referral information into the EHR or another system, and then they have to send that request to the scheduling team so that the actual visit can be scheduled. Now, sometimes if you're in a multi-specialty group practice, the processing of the referral and the scheduling may very well be done by the same person. If you are not in a multi-specialty group practice, there may be two separate teams doing it. But we thought it was very important to measure how long does it take to process that referral, in addition to how long does it take to schedule that visit. And the time to process that referral, what we found was that 61% of our respondents reported that it takes more than 10 minutes to process that referral. 25% of our respondents reported that it took more than 15 minutes to process that referral. And if you're a specialty practice and you have staff that are doing this job, the majority of your patients are originating from referrals, probably somewhere between 50 to 80%, depending on the specialty, which means that combined time to process that referral, if we move to this next slide, and schedule that visit could take nearly 19 minutes for some portion of visits. So again, if you're a specialty practice, and again, you are processing, trying to schedule patients for visits, it is very likely that between 50 to 70% of your visits are going to take possibly 19 minutes to actually schedule those patients for a visit. Again, small percentage of a primary care practitioner, this is not going to be an issue, but this is going to be the vast majority of visits if you're in a specialty center or in a health system where you're scheduling a majority of specialty related visits. So these visits that are resulting from referrals, if they're taking 19 minutes, are getting scheduled at a rate of just 3.16 per hour. And remember, this is the production rate when call centers and patient service representative roles are fully staffed. Remember, I said at the beginning, the PSR vacancy rate was 12.9% in 2021, and it's rising, and it's likely higher today. In fact, when we talk to health systems around the country, many of them will report anywhere from dozens to hundreds of vacancies in PSR roles. So on the next slide, it's not surprising to see that it is really, really hard to find the talent to fill these roles. In fact, what we heard in our survey is that 44% of respondents report that it is more difficult or worse to hire for call center talent than it is for other roles. Now, mind you, they also, the other 52% reported, well, it's the same to hire for these roles that it is for any others. And as I said, healthcare is not an easy industry to hire in right now. In fact, what we're seeing is that the competition for entry-level roles is exceedingly high because the wages in healthcare often lag behind what they do for other entry-level talent in other industries. And then worse, turnover rates in healthcare are actually 4 points higher than the average across industries, and actually exceed commerce, shopping, education, and even food and beverage. So what we have is a system right now, which is scheduling in healthcare, that is extremely reliant on people, but it can't afford to rely on people because they can't find the people to actually process the inbound calls or actually make the outbound calls to schedule patients for visits. And this has become very, very frustrating. Now, at many systems, what they have attempted to do is to get beyond this by building out online scheduling. This is not a new issue, this idea of over-reliance on scheduling, or on over-reliance on staff to support scheduling. And so, it is why digital scheduling systems have really come to the market. But what we have found is that most health systems have really crafted digital scheduling solutions to just provide patients choice and options. And these solutions are not really delivering the expected outcomes. First, they're only offloading a very, very small portion of the scheduling burden. In fact, what we learned in our survey was that 71% of respondents reported that less than 10% of their visits were being scheduled by patients online. And of those, more than 3/4 of those respondents, those 71% of respondents, reported that less than 5% of their visits were actually scheduled by patients online, which is very, very frustrating. And I said it's because, to a large extent, systems have built out this capability as a provider directory, as a menu for patients to choose when, among providers to schedule with. But the reality is most of us, need to schedule, most of us need to get access to care because as a result of a test, as a result of a service, as a result of a health system needing to reach out to us to get care. And then as a result, we are very limited to whom we can schedule with. So just going back to my point here, if you recall, when we said, this over-reliance on staff is not a new issue, we've already said 71% of respondents reporting that less than 10% of patients' visits are being scheduled online. Well, a large part of that is a large part of that burden, if you will, is not being lifted because providers themselves are resistant to opening up their calendars to actually allow scheduling online. What we asked was, why are your providers resistant? Or are your providers resistant? And 62% of respondents actually reported that less than half of their providers were even allowing patients to self-schedule online into their calendars. And 38% were reporting that less than 1/4 of providers were allowing patient self-scheduling. Well, it's not shown here, but we actually drilled down a little further to understand the root cause of this resistance. And what we found was that 66% of respondents reported that provider resistance stems from concern around online scheduling capabilities. And more than 1/3 actually reported that physicians have concerns that technologies aren't going to meet their needs, and another 25% fear the technologies will not sufficiently prevent booking errors. In fact, only 16% of respondents that reported that providers are not resistant to self-scheduling online. So if you are a health system, if we just summarize this for a second, and you are trying to put out a provider directory for patients to access and schedule online, but then less than half of your providers are willing to allow access to it, it makes the whole notion of that provider directory and that notion of offering self-scheduling sort of very imperfect. And really for patients, it does not provide the access that you would hope. And in fact, this should not be surprising when you think that when we did a survey last year, 70% of respondents of our survey said when they tried to use a directory online and schedule with a provider online, they actually had to go ahead and use the telephone instead. So we're not surprised to see this data because what we find when we talk to providers is that many providers are very frustrated, frankly, with the capabilities of technology and the capabilities of electronic health records. And as a result, they are reluctant to frankly give the access to them and, and are not convinced that those systems are going to serve their needs as need to be. Scheduling is a very complex matter. There are a lot of rules. There are a lot of complexities that have to be navigated as you understand what does a patient need? What kind of physician do they need to see? What kind of service do they need to have? To put those three variables together in a very complex formula is not an easy thing. We have relied on humans to do that. And it's understandable that in a world where we've relied on humans to do it, we want to continue to rely on humans to do it. But the reality is that is not serving digital scheduling well. And what we have learned at Notable through intelligent automation is that there are a lot better ways to do it. Moving to the next slide, though, I just do want to make clear that, when we asked the respondents who was providing your online scheduling solution, where are you getting this capability from? 53% of respondents did report that online scheduling is being provided natively through their EHR. 47% actually reported using a point solution. So, the reality is right now, the majority of this capability is being provided by electronic health record systems, and then there are a couple of point solution vendors out there. And then in addition, and that frankly, the functionality that people are getting, they're not super satisfied with. On the right-hand side, what you can see is that, when we ask them, how would you rate the performance of your current patient self-scheduling solution, 44% of respondents rated performance as poor or worse. 56% did rate it as good. We actually did offer the excellent option. Not a single respondent rated the functionality of their online scheduling solution as option, so as excellent. So I would, I think it's fair to say that, digital self-scheduling right now is getting just a passing grade when it comes to its performance across the industry. And I think there's a long way to go in terms of what the industry can do to try to improve performance. So just to try to wrap up these results, I think our results do send a very clear message that it's really time for the industry to hang up the phone, if you will, on telephone-based scheduling. What we are seeing is that it's compromising access to care across the health system. And there's just a couple of other results here that I wanted to share with you. And these are results from other sources. First, telephone-based scheduling, during weekday hours, if you think about it, it's just not meeting the vast majority, the needs of the vast majority of patients and parents. I mean, if you think about it, 76% of adults right now, ages 25 to 54, work. If you're a working adult, trying to get in touch with your physician office or be available to receive a call from your physician office during a weekday, which is when your physician office is open, is extremely frustrating. And it's frankly not really when any of us wants to have to try to make an appointment or, reach out to try to schedule a visit. So it's right there in itself, not serving the vast majority of adults, or adults out there who need access to care for either for themselves or for a family member. And then second, this is kind of remarkable here in 2023, but the reality is we have so moved past the idea of digital or telephone-based outreach. It's actually become antiquated, and it's frankly feels so foreign to many of us that it's giving us pause to even answer the phone. Unless the caller ID works, I'll be honest with you, I will not pick up the phone, and I'm not alone. So the answer rate on unidentified calls or on unidentified numbers right now is 19%. So that means if your patient that you are calling out to from your health system is not expecting a call from you, and they don't recognize the number that they see from you, that health system may be likely making as many as 5 calls to that patient to get an answer, which means when you think about that productivity involved in scheduling, all of a sudden that productivity is getting worse and worse and worse because frankly, people don't want to interact with their health system by telephone. They expect to get a text. They expect to be able to serve their needs through their smartphone. And then to the right-hand side, just some data from the survey we conducted last year with patients, 1,000 patients nationally, asking them, what do you really want from the digital experience in healthcare with your healthcare organization? We learned that 61% agreed or strongly agreed with the statement that they had actually skipped going to the doctor because it was too much of a hassle to schedule an appointment. And of course, this was using the telephone. So, we are really at a moment in time where we feel like we need quickly to bring up the capabilities of health systems nationally to actually serve patients much more effectively. And that is really where I wanted, and frankly, we need not to do this just for patients. We need to do this for our staff as well. You know, really our staff is looking for automation to solve this problem. As we say here, scheduling is ripe for automation. It's ripe for automation because what we are finding is that the care team is really hopeful about the opportunity that technology can bring them. You know, they are used to using technology in patient care. They see its potential. They are very optimistic, but they also realize that there is an enormous administrative burden that comes with healthcare, and that administrative burden is dragging them down. You know, we are continuing, when we think about technology and thinking about how solutions are built for healthcare, building solutions that are relying on staff to work through queues of patients, whether they are patients who need visits, referrals, prior authorizations processed, you name it. This is all administrative burden, working through lists of people that we have to then check off a box and, you know, basically move data from one system to another system, or rekey in data, or call out to patients to get something done. This administrative burden is dramatically undermining staff experience. It's fueling burnout, and it's frankly driving talent from the sector. And you can just see the data on the right. These are data from our own notable state of automation report last year, where we actually surveyed healthcare team perspectives across the country. We surveyed 1,000 care team members in a variety of different roles at health systems. And what we learned was 57% reported that they were worried they were going to burn out due to the volume of repetitive tasks that they have to complete. But again, given the potential that they see in technology, 81% are actually really hopeful that technology can help them improve their experience at healthcare as healthcare providers. And 48% really want to make sure that health systems use that technology because they are very worried about their organization's ability to hire and retain staff without using technology and without using automation. So, you know, we look at scheduling as just a function for health systems that is incredibly ripe for automation, and that we should be pointing our resources toward quickly to use to improve healthcare access in health systems. So going to the last question, or last section, I should say, how do we change this paradigm? You know, we believe very strongly that we need automated scheduling to drive efficiency and competitive differentiation. It's convenience that we need to really offer to patients, and it's convenience that we frankly need to also offer to our staff. And based on our experience, we have actually crafted 4 principles that we believe should guide health systems as they build out digital scheduling capabilities. You know, we think that there's no better time right now than to use artificial intelligence powered automation to address this kind of a challenge. And, you know, Notable has been using this kind of artificial intelligence powered automation for quite some time to power personalized digital outreach to patients and enable patients to successfully schedule tests and services across a wide range of healthcare needs. And, you know, we want to share what we have learned from doing this with you. Just a couple of slides to sort of give you a little context. You know, why is Notable even in a place to provide this kind of guidance? Well, first, you know, I think it's important for you to understand who Notable is. We are really a leader in intelligent automation for healthcare. We are the industry's only technology right now to transform patient and provider engagement and operational efficiency using intelligent automation exclusively in healthcare. And we are working with organizations of all types. You can see here large health systems and academic medical centers, independent hospitals and regional health systems, specialty clinics, FQHCs, even serving many populations speaking multiple languages. And we are helping them them use intelligent automation to really expand access for their patient populations, schedule visits, and basically get access to care that they need. These are providers who are really reimagining how patients access care at their systems. And right now, we are extremely proud of the work we are doing. You can see that our work has been validated by class and by our customers who report that 100% of our customers who report to class that they are seeing value in the first 6 months of working with us, and that they are highly likely to recommend working with us. The foundation of what we do is in bringing this consumer innovation to healthcare is our AI-driven platform, which I did just want to spend the next slide reviewing with you quickly. Our AI-driven platform has 3 major components to it. There's an integration component, which really are the systems and data sources that we connect to through a variety of methodologies, whether they are APIs or robotic process automation. And what we're basically trying to do here is we are accessing the right data in the right field, whether it's in an EHR, practice management system, or a third-party system, or a partner ecosystem. We are then taking that data and powering engagement using artificial intelligence, computer vision, natural language processing enabled by the latest large language models to process information and get it to the right format to drive action, which is what we showcase on the right-hand side. And that action is how we engage the patient and automate the work. And we do this by really driving an outcome for the patient. We drive registration and intake. We drive that prior authorization happening. We drive that scheduling of a visit. And I think it's important to just understand we have been doing this for 6 years. This gives us the credibility and the experience and the capability to be able to say, we have learned a lot from this, and we want to share our insights and our principles for how we have done this well, so that hopefully you all, as listeners on the phone today, can learn from this. So the first principle I want to share is here, and that is that, artificial intelligence really is required to effectively navigate the complexities of matching patients to providers and services. Anyone who is coming to you with a solution today and is not leveraging the latest artificial intelligence capabilities to try to really navigate the rules and the preferences that are necessary to get providers to want to adopt a digital scheduling solution is not really leveraging what is the best in artificial intelligence capabilities out there. We find that if you are going to navigate the complex appointment templates and preferences and quickly demonstrate the capabilities and earn the confidence of providers to drive adoption and use of digital scheduling, you are going to have AI to do this, because AI can actually do this navigation faster than a human, and it can do it with much less room for error. And, we have actually demonstrated this by scheduling patients for annual wellness visits, mammograms, and a number of different services. It's important because these AIs and LLMs can really develop a comprehensive understanding of physician clinical scope and really match patients with the right need to the right doctor for the right care, and set up that right preparatory test and service, and then also set up the downstream needs post-discharge or post-visit when that kind of outreach is prompted as well. So, it is really important that whatever solution you consider, artificial intelligence has to be powering it. It is absolutely required to make sure that it is going to work effectively, and the latest artificial intelligence capabilities. Second is that principle number 2 is that, whatever system you create, it has to be founded on personalized, proactive outreach to patients, so that health systems can actually pull patients in and frankly preclude the need for the call center altogether. Health systems right now sit on an enormous amount of information about patients, and that information can be used to absolutely revolutionize how they engage with patients and pull them in to receive the care that they need. What we think has been a shortcoming for so long is that patients or health systems have thought about digital online self-scheduling as a provider directory. And that is really just a means to an end. That is one small piece of what needs to be done. What you actually have to do is really think about how are you going to, based on the information that you already have about patients, pull them into your system to schedule needed tests, screenings, vaccinations, whatever their need is, and then actually get that data right into that electronic, get them scheduling that, appointment right into that electronic health record quickly and effectively. And then the third point of that is that outreach has to prompt action. You cannot provide a digital patient experience if it doesn't power action, regardless of access to the portal for a patient. So don't just have a provider directory online and then ask a patient to call. That's not an effective digital patient experience. When you think about creating that digital scheduling experience for your patient, it must power action for the patient. It has to guide them to the right provider, to times that are relevant to them for the service that they need. It has to confirm the appointment. In a perfect world, it's also pulling information about an existing patient and maybe even providing care recommendations as well. And is doing this, as I said, through outreach, and is doing this in a very personalized fashion where at the end of the day, it is powering action for that patient. It is powering an outcome. It is not just giving them an opportunity to see what's available. It's actually letting them get something done. And then finally, the last principle, scheduling should be really just one step in a holistic experience for patients. It's a holistic experience that is seamless and touchless in terms of their digital journey. We don't want to have, that patient must be at the center of engagement. One experience that unifies all the outreach and all the causes for outreach, whether they are financial, clinical, or administrative. We can no longer fragment that digital experience for patients. It just drives confusion for them. And frankly, it's creating work for our staff downstream. And health systems don't have the staff to do that work downstream. They don't have the staff to go through these queues. They don't have the staff to check off the boxes, to cross-reference the data. New systems have to leverage artificial intelligence and artificial intelligence powered automation through digital assistants to actually get the right data into the right place in the EHR so that you can free up the care team and frankly, patient service representatives to have human-centered interactions that are really central to why they choose employment in the healthcare industry. Again, this is why patients go to health. This is why I should say staff go to healthcare to work. They go for the human element. They don't go for the administrative burden. And what we want to do is to have digital assistants really fill in and take on that administrative burden, so that the humans that we have can really, bring joy back to what they are doing in their work day to day, and in terms of how they, and joy back to how they care for patients on a day in and day out basis. So with that, I'm going to wrap up and open it up for questions. I'd love to hear if there's any from the audience. Sarah, if you're still there.
Absolutely. Yeah. Thanks, Carly, so much for sharing that data and those insights. We do have time for a few quick questions here. So the first one I have is, why do you think healthcare has been so slow to move away from telephone-based scheduling?
I would argue it's because the technology just really hasn't existed. We have been working in a world where we have tried very hard to create a lot of paper-based rules and checklists for staff to follow. And the reality is we haven't really had the automated, we haven't had the automation, we haven't had the AI powered automation or intelligent automation, as we like to call it, to really be able to power digital assistants to be able to navigate that. And as a result, what we have found is that absent that capability, vendors instead went about the business of, as I've already said, providing or delivering provider directories. And directories are really just a means to an end. You have to have a directory, sure. The digital assistant needs to have a directory to be able to reference. But at the end of the day, what you really need to be able to create is an intelligent digital assistant that can actually, go through and use artificial intelligence and optical character recognition and natural language processing to be able to pull out the information that's critical, create the right questions, ask the right questions, pull out the information is critical, and then match a patient to the right provider for the right service. And then frankly, prompt the right necessary preparatory activity that needs to happen next. So, now that capability exists and that, healthcare is becoming much more familiar with this capability, I think we are starting to see a lot of health systems get into this. What I'm proud to say is that Notable, we have actually been doing this for quite some time, and we are excited to talk about this. And of course, this is why we wanted to do the survey, to really showcase there's a burning need out there, and we'd love to be able to help health systems address this.
Yeah, absolutely. Thanks, Carly. And that leads right into the next question, actually. So this attendee asked, how is Notable approaching this differently? What unique capabilities do they bring to the table, and how can this solve problems for providers?
Sure. We really believe that for many health systems, what they're doing is they're actually waiting for patients to come to them to schedule. And, we just think that that's a very short-sighted approach. There's only going to be a small portion of patients at the end of the day that are going to say, oh, I need to schedule this, that, or another thing. But there's a lot of patients who exist within your electronic health records who have needs and that we need to reach out and schedule. And frankly, if they didn't exist, you wouldn't have a call center. So rather than have that call center, what we believe is a better way to do it is to have that digital assistant that can actually, power the outreach and then to that patient when they need something scheduled. And, you can do that in a lot of different ways. I'm not saying that the call center shouldn't exist, but this call center should really be servicing a minority of patients who want to do this by telephone. The reality is, though, the majority of patients are very interested in scheduling the vast majority of their needs through a smartphone. And if you can reach out to a patient when they are due for an annual wellness visit, when they have a pending order for a service, when they have a specialist referral, and you can automatically fully process that referral and then outreach to them, to that patient once that referral is processed, when it's all ready to go, and then to schedule them with the appropriate practitioner, you have a moment with the patient that feels much more fruitful, much more engaging, and frankly drives to an outcome. And, that's why we think that we are doing this differently. Notable is really driving to getting that patient to the desired outcome, which is the visit with the provider. It's not just focusing on availability or access. It's really, as I said, focusing on outcomes, and in particular, focusing on outcomes that ultimately will drive patient retention and patient engagement with their health system, and, patient loyalty with their health system. And at the same time, increase staff capacity within the health system, so that, staff within the health system aren't spending all of their time on the phone processing paperwork. They are instead spending their time maybe engaging with patients directly in the room, in the waiting room, or assisting medical assistants, or assisting with caregiving on the clinical side. There's just a lot that we can be doing to provide a much more rewarding staff experience for the care team by taking all of that administrative work and leveraging it to digital assistance. So, those are the capabilities that we're using, that idea of combining artificial intelligence and automation to really power that outreach to patients, to pull them in, to schedule them when we are ready to have them scheduled for a visit, and to help them get to an outcome quickly through that digital intervention.
Great. Well, thanks, Carly. I think we have time for one more question here. So the last one I have is, what is your experience with using digital outreach for scheduling, and what level of engagement do you see?
Sure. We are been using digital outreach for scheduling to schedule a number of help patients close a number of care gaps on the population health side. We've been helping patients schedule mammograms. We've been helping them schedule diabetic HbA1c tests, eye exams, colonoscopies, a number of different services that are all annual wellness visits, of course, for Medicare Advantage patients. There are lots of different services that we have been working with our members to help, COVID screenings, COVID testings, and we've had great experience with it. And our engagement rates are actually very impressive. They are twice, frankly, what you would see from an answer rate on a normal phone call. If we're seeing right now that less than 20% of patients will answer a phone from an unknown caller, we are seeing levels of engagement starting. That means they open the message from us starting at 40% and higher. And then, we can get much higher than that very quickly. But that's just, when we send those messages out. So I think it's important to understand that patients, when they get a smart, personalized, proactive outreach to them through a digital interface that is engaging and delightful, they will actually open that message and they will engage with it. And we are finding that patients will do that. And what we also find is that when we work with organizations who are, working with patient populations that have multiple languages, getting away from the telephone and actually being able to send a digital outreach to a patient in a language that is obviously matched to what their language need is, makes all the difference. We are sending messages to patients in English, of course, but Spanish, Portuguese, Khmer, a number of different languages right now, all across the country, as we help our organization serve patients of all different types and ethnic groups. And frankly, it's really trying to it's really effectively expanding access to care and improving health equity in a number of different communities. So, digital outreach works, and it works for all variety and manner of patients. And it's really the way that this healthcare needs to be going if they are going to open up access to patients writ large.
Absolutely. Well, thank you, Carly, so much for spending time with us today and sharing your insights. I'd also like to thank Notable for sponsoring today's content. To our audience members, thanks for joining us today, and we hope you have a great rest of your afternoon, and we'll talk to you soon.